Hello, my name is Patrick Brown, Mayor of the great city of Brampton, and I'm joined today by Dr. Lawrence Lowe, our Medical Officer of Health in Peel Region, and Paul Morrison, who runs our bylaw department in the city of Brampton. And this is for our weekly COVID-19 update. I want to start off by saying it continues to be an encouraging picture in Peel Region. High vaccination rates continue to create a safer environment in Peel Region and Brampton, Mississauga, and Caledon. I am encouraged that the vaccination rates, especially amongst second doses, continues to climb, and that is leading to less and less COVID cases. I believe the most recent positivity rate in Peel Region is only 1%. And you just think back a few months ago when we had a 22% positivity rate in Brampton. So vaccines are doing exactly what we expected. They're working, they're protecting the public. I would note that the GTHA mayors met this week, and we identified throughout the GTA that we need to do a bit more encouragement getting those over the age of 12 to get vaccinated. We want to be in great shape for when school returns in September, and so for young people who haven't got vaccinated, please do to make sure that you're protected as well. In terms of Brampton Civic update, we only have 4 COVID patients and 1 person in ICU. Once again, go backwards a few months. We were transferring 100 patients out of the hospital a week because we were over capacity at the hospital. So a really encouraging picture. And on that note, I wanted to speak to one issue today that I believe could help with our reopening. I think we all understand that COVID has changed things in Canada, and as we finish this pandemic, there are some new realities, and one new reality is that our mask mandates have been extended. The medical advice is clear that in indoor settings, particularly when there are still some variants of concern in unvaccinated segments of the population, that we're going to have an indoor mask mandate for some time to come. And on that note, I believe that we need to make some of the provisions in the mask mandates a little more reasonable, and I'm going to speak to that. Right now, with the Reopening of Ontario Act, municipalities are required to enforce mask mandates, and some of the aspects under the Reopening of Ontario Act are very difficult to enforce. I have sought medical advice on this to get advice on what is safe for Bramptonians, and the general advice has been that indoors you want your population to have masks on, but outdoors it's relatively safe. And there are aspects of the Reopening of Ontario Act that continue to make masking mandatory outdoors. And I would encourage the province to look at those aspects of the Reopening of Ontario Act that could be amended to make it easier on municipalities to show the public goodwill who have done so much to get us to where we are now in the pandemic. And let me give you some examples. Section 16.4 of the Reopening of Ontario Act makes masking mandatory around sports fields. So outdoors, parents will have to mask up when watching their kids play sports. That seems unnecessary. If you look at our farmers markets, where we have large outdoor spaces, we continue to have masking mandates. Organized outdoor events. We have a flag raising at City Hall where we've got a giant space and usually only have a few people come. We're still required to wear masks even in those large outdoor open spaces. If we want to have an outdoor movie at our garden square, a large outdoor space that normally children in our community enjoy, once again, they would not be allowed to watch that movie outdoors without a mask. And so I believe under the notion of reasonableness when it comes to outdoor settings, I'm hopeful the province will look at the Reopening of Ontario Act and amend the aspects of the Act that still have in place the mandatory masking policy outdoors. I get that it's different if it was a large concert venue where people are crowded, but for outdoor spaces where, frankly, people have the ability to move freely, not in a crowded manner, I believe it's time to update our masking bylaw to recognize where we are today, and the picture has dramatically improved. On that note, I just want to thank everyone for their continued incredible efforts. Brampton was hit really hard during the pandemic, and I think we're in a great place right now. And it's because of the high vaccination rates. It's because of the fact that everyone took the public health advice to heart and followed it. So keep up the great work, and there are better days ahead for sure. I think the hardest part of the pandemic is now behind us, and it's just great that we're finally getting back to normal. And it's now my pleasure to introduce someone who really rose to the occasion and helped our residents in a tremendous way during this pandemic, and that's our Medical Officer Health, Dr. Lawrence Loh.
Good morning. And thank you, Mr. Mayor, for your kind words and also for your leadership as well. Our trends today stand at 8.3 cases per 100,000 and 1.6% positivity in the city of Brampton. Our vaccine coverage continues to grow, with almost 80% of our 12-plus population now with one dose and nearly 60% with a complete two-dose series. And while supply allowed us to provide a Pfizer Friday last week, I want to reiterate and thank all our residents who have gotten 2 doses of any mRNA vaccine that is available, understanding that they are interchangeable. In fact, as our supply issues continue to resolve, we are able to offer more of both Pfizer and Moderna to our residents in our clinics every single day. When you do arrive for an appointment, I urge you to take whichever of the 2 vaccines is available. The best protection that you get is the one you can get the soonest. Getting to 2 doses, regardless of combination, does that. Thank you again to all the residents who have taken 2 doses of COVID-19 vaccine as soon as they could. You have pushed our vaccine coverage to tremendous levels. In particular, an impressive 92% of our 18 to 24 population in the region of Peel has now received a first dose, showing us the way forward. I'm hopeful that many of this group will return for their second. Getting to the same level for our entire community will limit any resurgence by stopping spread and preventing severe illness and death. And for our youth aged 12 to 17, there is still time to get both shots before school starts again. You need to act swiftly, though. With a 28-day interval and with full protection coming 2 weeks after your second shot, you need to get your second shot in by August 24th to have that full protection when you return to school. I'm happy to announce our Vax to School campaign begins today, and we have a fast line today and tomorrow to kick this off at our clinics to make it quick and easy for you to get your first dose if you haven't yet already, or your second dose if it's been 28 days. Youth that are aged 12 to 17 just need to show proof of age to skip to the front of the line together with their accompanying family members and get their shots. Ensuring that our youth are fully vaccinated is the surest way to ensure that returning to school in September is as safe and smooth as possible. So for those of you who are able, I also encourage you, get your vaccine and continue to demonstrate your care for your family, your friends, and your community. It especially matters for us in Peel and in Brampton, where without a vaccine, we had to reduce contact and interactions through significant widespread community disease control measures over 3 waves. If you remain unvaccinated, you remain unprotected, and that means you are putting yourself, your family, and our community's progress at risk. Even if you are healthy now, data increasingly shows that the odds are not in your favor. Those who are dying and hospitalized of COVID-19 are increasingly individuals who were wholly or partially unvaccinated. But we can change this. In the coming months, we will receive enough vaccine to vaccinate every eligible resident in Peel. And so we are transforming our capacity to take walk-ins, to offer more community clinics, and to adjust hours to allow people to get vaccinated with as few barriers as possible. In fact, today our mobile team will complete 2 doses at all of our 168 high-risk congregate living settings in our region, a campaign that started in February. We now have that mobile team available to move on to new and expanded community settings to ensure that we get the last 15 to 20% of our residents the protection that they need. COVID has cast a shadow on our community and on all of us because the virus is new. But getting vaccinated helps your body to recognize the virus by creating antibodies so that any exposure in the future is likely to only result in mild infection. The vaccines are safe and effective, and once we are all protected, we're almost assured that we won't have to move backwards again. So please do not wait. As contact increases, the risk of transmission will grow, and I don't want to see you remain at risk of severe illness or disease. Please get to 2 doses as soon as possible and visit peelregion.ca/COVID-19 vaccine to book your appointment today. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. On that note, we're happy to take some questions. First up is we have Chanel from CP24.
Hi, Mayor. Thanks so much for taking my question. Just wanted to follow up with you about something Dr. Kieran Moore said yesterday. He said he'd like to see 90% of Ontarians fully vaccinated before easing any more restrictions, before we see things like masks not have to be worn anymore. But the Premier before had said that the initial target was 80%. Just want to know your thoughts on those numbers and sort of where you see this going in terms of easing more restrictions.
Well, I think it obviously is a great goal to have, an aspirational target. The more people vaccinated, the better a position we're going to be in. I think Dr. Lowe would have better insights in terms of what is achievable in Peel Region. You know, at some stage you do run into segments of the population, for whatever reason, has vaccine hesitancy and are less willing to get vaccinated. I would hope that there is more reasonableness on the provincial front in terms of restrictions that can be safely lifted. And the example that I illustrated today of outdoor mask is an example of that, that shouldn't be held back waiting on a target we may or may not ever hit. And maybe Dr. Lowe would like to speak to that as well.
Thanks, Mayor Brand. Thanks, Chanel, for the question. I think it's important to clarify the two numbers that you're speaking to. As I understand it, Dr. Moore indicated that the 80% first dose, 75% second dose, and no health unit below 70% amongst other healthcare indicators is related to the exit from the Ontario roadmap, at which point they would consider exiting the provincial roadmap to reopen. However, I think the target of 90% that Dr. Moore is speaking to really speaks to the other measures that we know will likely still remain in place even after the roadmap to reopen ends. We know, for example, that masking, particularly in indoor public spaces, in crowded settings, will continue to be necessary because the vaccines aren't 100%. We've seen many countries that have reversed mask mandates very early, especially in the face of the Delta variant, and then quickly had to put those back. Los Angeles County, in the United Kingdom, in Israel. So I think the reality is that these are two slightly different sets of numbers that you're speaking to. The first is the 80-75 is what Dr. Moore was speaking to as to when we exit the roadmap to reopen, or at least start considering it. And the 90% is probably speaking to broader measures such as indoor masking that likely would need to stay in place even after the roadmap to reopen has concluded, and hopefully not indefinitely, but until such time that we are certain that transmission has come under control. Thanks.
Thanks so much for that. And just one more question. We're less than 2 months away from school now. Just wondering whether, Mayor, you're concerned about the lack of clarity on what the reopening of schools is going to look like. And Dr. Lowe, if you have any ideas about recommendations you may be putting forward in your region for children that are going back to school for in-class learning in September.
Well, I'll have Dr. Lowe speak to this, but I would just add, I do want to see children in school. I want them to be with their peers. I want them to be learning. I do think there is a cost that is incalculable in terms of children being out of school for an extended period. And if we can safely have them in school, then absolutely we should do everything possible to make that happen. It's one of the reasons the GTHA mayors are having this push right now to get those over the age of 12 vaccinated, so that we know that high schools will be very safe environments. And a lot of the COVID transmission in schools, when schools were open, were happening amongst those over over 12 and less so for those under 12. And so I do think we're in a good position for schools to return. And I'm sure if there are additional steps we can take to protect educators and students, that everyone would listen to Dr. Lowe's advice to make sure those actions are taken.
Yeah, thanks, Mayor Brown, and thanks, Chanel, for the question. At this time, we're not contemplating any additional measures specific to the region of Peel because we are still in active discussion with our Ministry of Health, our local school boards, and the Ministry of Education as to what school return will look like. I think the science table has been particularly clear around some of the measures that would be recommended in a prudent return to school to really ensure that students are able to derive that benefit of in-person learning, but that setting remains as safe as possible. It's why we're actually launching the Vax to School campaign this week. Again, front-of-the-line access for people aged 12 to 17 in our region to get their first doses this week so that they can get their second dose by August 24th and be able to have that full protection. Certainly encouraging teachers and staff to also get vaccinated, and then looking at measures that may be implemented, such as continued masking, at least at the start, as well as things like cohorting, screening, those measures that we've all become so accustomed to, just making sure that continues while again we make sure that everything remains remains in a good way in terms of our continued transmission picture. So those are some of the things that are being actively discussed. Of course, there will be further confirmation and eventual decisions taken by the Ministry of Education as to the standards that will be implemented to control COVID-19 transmission from entering the school setting. Thank you very much for the question.
Okay, our next question is Sabrina from the Mississauga News.
Hi there. So my first question is for Mayor Brown. So I just wanted to hear comments about a couple of videos that had been circulating on social media, and they appeared in a number of news articles, which shows a number of people leaving the line at the Save Max Sports Center after being told that they would have to mix and match doses last week.
Well, my hope is that everyone gets vaccinated, and I know Ontario and Canada was short Pfizer, but I believe that is readily being fixed, and that there is additional Pfizer becoming available, and I'm sure Dr. Lowe can speak to that.
Yeah, Sabrina, thanks for the question. Certainly those videos really, my heart sank when I saw those videos because, many of the people in that line I saw were people that were walking away from protection. I know that there's hesitancy around Moderna, there's hesitancy around mixing, but the reality is that we, the mixing of medical products, pharmaceuticals, vaccines, this is something that occurs routinely. The best example I can give you is if you needed 2 units of blood, to save your life, you wouldn't expect the 2 units of blood to come from the same donor, and your body would use them the same way. And so it's the same with the Pfizer and Moderna vaccines. It was certainly disappointing to see. However, it is very positive to know that the Pfizer supply issues that we had through the early part of July have resolved. As mentioned last week, we were able to have a dose-specific day with Pfizer Friday. We're looking at our current supply to determine if that's something that we're able to offer again. And I can't stress this enough. Every day in our clinics now, for every person that shows up, there is some Pfizer and some Moderna available, and as the supply improves, we are hopeful that both of those products will continue to be available for our residents. The supply issues have appeared to have resolved for now. Thanks for the question.
Thanks. And so my second question is for Dr. Lowe. So in Peel region, the dominant variant of concern is the Delta variant, and I'm wondering if that is expected to change with the Lambda variant, and also I'm wondering if you know if there are any confirmed cases of Lambda in Peel region.
Thanks for the question, Sabrina. At this point in time, I'm not aware of any confirmed cases of the Lambda variant in Peel region. Delta does seem to be outcompeting a lot of the variants, but here in Peel, while it has become our dominant strain, we do know that the Alpha variant still is also circulating to some degree as well. I think the more important message around the variants is, regardless of what variant is circulating, right now evidence is clear that 2 doses of vaccine provides excellent protection against any of the variants that are in circulation in our region, and I urge our residents to get that protection as soon as possible. Thanks for the question.
Okay, our next question is Jeffrey Allen from Insaga.
Mayor Brown, we're starting to see vaccination rates slow down, and we're going to soon get to the point where the only people who are not vaxxed are those who won't be, that there's a very large vocal or a small vocal minority of people who are very anti-vax. What do you say to those who are vaccinated being asked to bear the societal burden of preventing spread of this disease because of the vocal and aggressive anti-maskers?
Well, I would say that those who have got vaccinated, they've done the right thing to protect their friends, their family, and their neighborhood. For those that aren't vaccinated, it's playing Russian roulette with their health. They're taking a risk, and if you have a loved one who's taking a risk like that, I would encourage you to have them speak to their physician who can better explain why vaccines are very helpful in protecting you. There's going to be some new data coming out that speaks to the hospitalization right now and the severity of cases we're seeing versus the population that is vaccinated versus the population that isn't vaccinated, and it's stark. The reality is, for the population that's vaccinated, the pandemic is essentially over. For those that are unvaccinated, there's still a serious risk of hospitalization and fatalities. And so, from my perspective, it's very clear. It's a no-brainer. Get vaccinated. Protect yourself. Don't play Russian roulette with your own health. But I'm sure Dr. Lowe can speak to that more broadly.
Yeah, thanks, Mayor Brown, and thanks for the question, Jeffrey. I think there's a few things I would have here. We certainly recognize that there's a spectrum of individuals who may or may not get, may or may not have had the opportunity to access protection through vaccination at this point in time. It's for that reason we're actually pivoting to address the slower rates by making sure that we are moving towards more community outreach offerings. By again, our mobile team, which just finished all of our high-risk congregate settings and providing 2-dose protection to all of those in the region. To be able to then start doing more outreach to those that faced barriers to getting into our mass vaccination clinics, particularly in areas of our community here in Brampton or throughout the region of Peel that are called cold spots, essentially places where we're not seeing as much vaccine uptake. A lot of it may be situational. People have multiple jobs, they work odd hours, they can't necessarily get access. They may be single parents that don't have childcare. So we're going to be trying many innovative ways to really reduce as many barriers as possible. And then for the last group that you're talking about, the people that are perhaps, vehemently against vaccination, the reality is that, at some point in any campaign that we have, there's always a group that unfortunately doesn't necessarily bear the risk. But the reality is, thanks to the kindness and the collective efforts of everybody else, they will also have protection via herd immunity and hopefully reduce transmission in our community. So I think the vaccines are safe, they're effective. I encourage everyone to do their part. Just like me, I got my 2 doses of Moderna, and hopefully we can continue to ensure that as we reopen, we continue to stay open. Thanks so much.
Okay, Jeffrey, is there a follow-up?
Yeah, Mayor Brown, post-pandemic, in that utopia everybody's hoping returns, do you see yourself continuing with these sort of direct press conferences on Facebook that can be accessed by your constituents?
Well, there may be different topics, but we actually started doing similar events like this in Brampton even before the pandemic started. We did this for our winter maintenance, for our budget, and we're going to continue to look at opportunities to engage the public. I think the pandemic has been great in terms of transparency and accessibility, and we have town halls regularly every few weeks in Peel where residents can ask the top officials any question they have, and I think this is a great model to follow on other issues that the citizens have an interest in. I think an engaged democracy is the best thing for any city. Our next question is Nitin Chopra from Prime Asia TV.
Thank you, Mayor Brown. My question is to Dr. Lowe. Dr. Low, if you can clarify that from 9th August, fully vaccinated Canadians or US citizens can enter Canada without have to quarantine. So do they still have to provide a COVID negative test 3 days before departure, before entering to Canada, or only proof of 2-dose vaccination is enough? Thank you.
Thanks so much for the question, Nitin. I don't believe that the request for pre-departure testing has changed, but again, this is a federal jurisdiction, so you'd be best to direct your question to the Public Health Agency of Canada and Canadian Border Services Agency to be absolutely certain. But my understanding was that if you had a vaccination, then the idea would be fully vaccinated plus proof of negative test meant that you could skip quarantine. But I would ask you to confirm with our federal partners. Thanks for the question.
Thank you. Follow-up is also with Dr. Low. Dr. Low, what is the durability of vaccine? And also the shingle flare-up, is that a side effect of COVID vaccine? Because some cases observed in Kingston, Ontario.
Thanks, Nitin. Again, just similar to my previous answer to you last week around adverse events following immunization, not able to comment on specific cases at this point in time. Shingles hasn't been identified as a relation, and as I mentioned, there are bad things that happen after vaccination, and a proper assessment needs to be done to really determine if they were caused or if they are just a coincidence. But in respect of your first question of the durability, there is continuing research to see how long the protection that we obtain lasts for. Initial research suggests very favorably that protection may be quite robust over the period of months to years, likely more on the years side, but there isn't anything firm at this point in time, as that is obviously research that is ongoing. Thanks so much for the question.
Okay, our next question is Nikki Cedroni from the Bramptonist.
Hi, good morning. My first question is for Dr. Low. With the border opening soon and more international flights landing in Pearson, what steps should fully vaccinated people take to protect themselves?
Nikki, it's a great question. I think at this point in time, they've taken the first and most important step to protect themselves by getting 2 doses of vaccine. And so if you're fully vaccinated, you can have that assurance that you're 2 weeks out from your second dose, you're fully vaccinated, your risk of severe outcomes and mortality is strikingly low as a result of that. So that's the first and most important thing. The second thing is to make sure that you're still sticking to a large degree to the precautions. So, please don't meet with people if you are feeling unwell. Please get tested and self-isolate instead. Please make sure that you're continuing to wear your mask, particularly in indoor public settings and in crowded groups where you may not know everyone's vaccination status. And of course, in those settings where possible, to making sure that you're distancing from people that you don't necessarily live with. Just the usual sensible precautions. But getting your 2 doses of vaccine, that is the foundation for safety. Thank you very much for the question.
Thank you. My next question is for Mayor Brown. Now that indoor sports and rec centers are open, have you visited any? If so, have they met your expectations?
Yeah, I think the city recreation staff have done a great job in getting our facilities open again. There was no delay. Part of the concern is when they're closed for an extended period, there could be a delay in getting them open again. But there was no delay, and it's great to see our community enjoying our rec centers again. We've got some phenomenal rec centers in Brampton, and we want the public to enjoy them, stay active, stay healthy, and I hope that we never have to shut them down again. I hope that because of the high vaccination levels and because of the sacrifices the public has made during the pandemic, that our rec centers are going to be busy and abuzz with activity for the foreseeable future. On that note, that completes all our questions today, and I want to thank everyone for tuning in to hear our COVID-19 update. Stay safe, stay healthy, and always listen to the advice of public health.